Завершая наш сегодняшний интересный день, и первый вопрос, я его сначала адресую Харальду Вольфу. Harald, could you please tell me what's in your opinion connections and integration with hymns can give to Russia? Катерина, прошу вас.
The most important lady of the house. Could you repeat the question?
What do you think, how connections with hymns can help Russia? What hymns can give Russia? Methodology, experience, how do you see this?
Well, first of all, I'd like to thank all of the speakers who have been incredibly gracious in mentioning hymns and talking about some of the attributes that we work very hard to bring forward. So first of all, thank you so much for that. I hope from the conversations that everyone has heard, we really would like to bring three basic points forward. One is the ability to pull together experts for conversation, thought leadership sharing, and best practices, both inside, which is very important to elevate the entire country, as well as from the outside, which helps add to that body of knowledge and accelerate. So from justice sharing and a thought leadership standpoint to bring the best of the world to Russia and the best of Russia to the world, that's step one. Step two, because of the maturity models that we utilize in the frameworks, we hope that they can be a guide as they have been here, but also we hope that they will be influenced by the great learnings as people innovate inside Russia and use them. These maturity models do change, and they change based upon the feedback of the actual experience on the ground. So from our standpoint, it's a winning situation when we learn and we gain. The third piece we'd love to bring forward is the consistency of the interoperability standards that we think are extraordinarily important for two reasons. Both one, inside, which is very important to elevate the entire country, as well as from the outside, which helps add to that body of knowledge and accelerate. So from justice sharing and a thought leadership standpoint to bring the best of the world to Russia and the best of Russia to the world, that's step one. Step two, because of the maturity models that we utilize in the frameworks, we hope that they can be a guide as they have been here, but also we hope that they will be influenced by the great learnings as people innovate inside Russia and use them. These maturity models do change, and they change based upon the feedback of the actual experience on the ground. So from our standpoint, it's a winning situation when we learn and we gain. The third piece we'd love to bring forward is the consistency of the interoperability standards that we think are extraordinarily important for two reasons. One, there's interoperability standards, which is the exchange of data inside any particular environment and ecosystem, and that's just large-scale system data to system data that's utilized in healthcare, whether it's IHE that was mentioned earlier, or even if you're looking at HL7 fire implementation on a specific basis. We think that those are important because by having those standards, it does lend itself to the semantic interoperability that was mentioned before. But the second part of it, which is really a benefit from the development of products and services, is that when you begin to utilize standard from interoperability from a device standpoint, then the products and services that you develop through the innovation, whether it's through the Institute or whether it's through individual innovations, those have a much better opportunity for approval on the world market and adaptation, both in terms of the European market as well as the North American market, both of which are open for the receiving those devices and moving them forward. So in the end, it's thought leadership, it's acceleration of the programs against international standards, and it's the development of innovations, products, and services. And those three pieces are probably the initial offerings that we would love in partnership to work within the country.
Представьте себе этот схожий вопрос.
A very difficult question. I would like to address the question to our Russian colleagues. What we can use in Russia out of this huge HIMSS experience, what we can take and apply, and it will be well in line with our processes and activities and what is going on in the Russian healthcare right now. I think that Mikhail Yurievich will answer this question in more detail, but I think that integration with such organizations as HIMSS, as well as integration of medical informatics society community in Russia, are of paramount importance, because otherwise we may move in a wrong direction. We have to look at what is going on around the world. We have to take part in their events. HIMSS is a wonderful platform. The standards and the experience they've accumulated is certainly extremely useful. And I think there's no difference between a clinic certified stage 6 and 7 HIMSS in the Far East of Russia, or in St. Petersburg, or in China or US. These are the clinics that most probably, from the point of view of the processes, organization, and quality of medical care, will be very similar. That's my point of view. Mikhail Yurievich? I think that HIMSS, as an international organization, accumulates best practices, as actually is written in their vision and mission, and they show how they work effectively. And since we're working in the same field, the business models may be different, but the field is the same. The human being, its health, his health, sorry. What has been used effectively in one country may be used as effectively in the other country. And if a hospital decided to move towards digitalization, certainly it's very good to decide what's to be done first, then second, then third, how to use the resources which are usually insufficient. So the experience and the maturity model of the information system developed by HIMSS is a kind of a roadmap. Move this way and you will find happiness at the end. And we have to understand that this is not a navigator, like turn right at the next crossroads. This is a shining star that shows you the way. HIMSS won't answer you which way to go. They simply show you the way to move to. When we had our first inspection, when the inspector came over, he asked us to show how the nurses' records are being used. We told him we do not have a practice of medical nurses in Russia to have records. The doctor makes a prescription and the nurse simply executes this. His answer was okay. So we asked him, shall we continue in this way? He said, yes, you may, but then you won't comply. So we sat down and thought, we started this journey, we want to have a new star on the European map. And so we started thinking, why did they think about medical nurses' records? And then we came to the conclusion that the medical nurse spends much longer time with a patient compared to medical doctor. And if a nurse detects certain issues in the condition of the patient, it is very good if she delivers this to the medical doctor. Well, it turns out that a medical nurse who was on duty during the night, she leaves before the medical doctor comes over in the morning, and there's a gap. So we decided to launch a section in the medical record where the medical nurse would be able to put down what she noticed and observed, and the medical doctor later on will be able to read it. This is not a must, but these are very strong recommendations, and if you follow these recommendations, you will really find happiness. And we've heard in one of the presentations that all the patients come to us to get certain results and the high quality medical service. Medical information systems and methodology of HIMSS shows us how to build up a system that will help secure the safety of the patient and high quality of medical care. Hence, that's the star that shows us the way. And it is possible, if we follow the star, to pass this way quite quickly and not very expensive.
Approximate level of
Екатерина, вы в презентации сказали, что очень небольшое количество ХИМСС в Чешской Республике.
achieving some high results, for example, MRAM 6 level for the main hospitals.
Thank you for the question. Actually, generally, if you want to get help or if you want to be cured, you have to admit to yourself that you are sick with all the addictions, with everything. The main problem is the hospitals and the management doesn't see what all you guys are talking about today, and you see quite clearly. They don't see that there is a problem. I'm attending a lot of discussions of the guys from ministry, of the directors of the hospital, and the main topic is really they spend 90% of the time, of the productive time, to discuss shortage of the doctors, shortage of the medical staff. Don't cure the symptoms, cure the basics. And we are trying to explain to them, if the nurse spends half of a day running from ambulance to ambulance with the papers, with the requests, with the results, if the doctor, to just see the medical data of the patient, has to actually access 50 different applications and to look for the data, write it on the paper to actually see what was really happening. If the lab method is done for the one patient, sometimes 3 times in 1 hour, because at one department they don't know what was happening at the other, you are short of staff, you are short of money. Take care of IT, take care of the electricization of the healthcare. Start there. That's the first step, how to actually move forward. The second step is for us to actually involve and motivate the decision makers and the influencers, and that's not only in the hospitals. They have to start at the Ministry of Health. They have to say to the hospitals, this is the right way. You are sick, there is something wrong, this can help you, this can bring you the medical doctors, the nurses, this can help your situation, this can bring you more money, save you the costs. Also for them it's quite difficult to actually admit that they didn't move the healthcare forward. So this is a tough job. This is where we have to start. And it's very, very difficult from us as a vendor to go to the ministry, to go to the doctors and tell them, use IG profile, start integrating. Have you heard about HIMSS and MRAM? They will always say, vendors, what are you selling? You're selling IG, yeah, that's why you're recommending me this. We need people like Half-Wolf from Independent Initiative to come to Prague and talk to our Ministry of Health. We need Daria as an MRAM consultant to come to our hospitals, make the gap analysis, and tell them, you are sick. Maybe that's gonna start a change and move us forward.
Thank you, Katerina. Спасибо. Johan, could you tell me what is the experience of the Netherlands in adopting HIMSS methodologies? What is the situation in Netherlands?
Well, in general, the Dutch are very positive towards HIMSS. For your idea, last week in Helsinki there were, I think, 150, 160 Dutch chiefs of staff, to listen to many stories in HIMSS Europe, but also there were some opportunities to speak together. We had 3 sessions in the afternoon, the Dutch amongst each other, to see how and what we can solve of our own problems. Because what you see on this moment is that what I told you about the standards and the quality standards, we see a kind of move which is not by us, the technicians, or by us, the doctors, but by the patients. What we see now is, after we have come to conclusions and asked the doctors, what is your standard? Ask the nurses, what is your standard? We start to publish it. And a small story in that respect is interesting. We asked the surgeons, please make a quality standard for adrenal resections, so an operation on your adrenals. How many adrenals do you need to remove per annum to be an experienced surgeon? And they came to the conclusion, first, it should be 10 per annum. And later they said the ideal way is 20 per annum. Okay, so that's your goal. Then we went to the Dutch Statistical Bureau and we got the data of all hospitals and the average of the last 4 years. So the surgeon said, you are only a good surgeon if you do 10 per annum. We have 100 hospitals and only 8 out of them did 10 or more per annum. So confront them with their own mistakes. And that started the discussion, and that started that the patients became consumers, but also that the management of those hospitals who didn't know these problems were confronted with their own facts and figures. We in the Netherlands are very happy with, in general, everything that HIMSS delivers to us and produces. And we are very, how shall I say, proactive with all the other things that we discussed. HL7 is for us, IHE is for us standard procedure. And on this moment, as a result of all this which was being taught to us by HIMSS, we have a certification process for the personal health record. It's called Met Mij, with me, and we are processing it on this moment, and by the end of this year, by Christmas, we will have about 50 to 60 applications which are certified by the group and blessed by the government, because our government is facilitating the process, but the process itself needs to be done by us. And I must say, this works now. We have got a very much, infected, maybe is the word, Erik Gerritsen. He's very much involved, Secretary General of the Ministry of Health. And time of bullshitting is over. We need to deliver.
Thank you, Johan. Thank you. Hal, would you like to add something?
Yeah, one of the key points that we're hearing from both sides is that it's critically important to have a strategy of what you're trying to accomplish and how you're trying to get from point A to point B. Michal, you had a vision of how this facility would work and how it would work from a paperless standpoint and how you would bring it forward with the use of information. And because that was embedded in the overall strategy, the decisions you made were there. What you hear, if I may be so bold, from the checkpoint is that the strategy is not to fix the system, but just to deal with the symptoms, where in the Netherlands they've been working very hard to develop the overall strategy and a vision for it. So I think it's the old adage, there's a passage in Alice in Wonderland, if you're familiar with this book. And Alice comes to a fork in the road and the Cheshire Cat is sitting in the tree. And she looks up at the Cheshire Cat and says, "Which path do I take?" And the cat said, "Where are you going?" And And she said, I don't know. And the reply was, well, then it doesn't matter which path you take. But it is a very short runway that we have from an economic standpoint to reform our ecosystems. The one economic piece that we were talking about earlier, which I did not put up, is that the number of citizens who work in countries, the ratio of those working citizens to individuals dependent upon the healthcare system is changing. Denmark, where I am a visiting professor and spend a significant amount of time, is a perfect example. Today there are 3.2 citizens per dependent in the healthcare system. Within the next few years, let me define few years, 10 years, that's it. 10 years, it will flip and it will be 2.3 citizens. 2.3 for each dependent in the healthcare system. So that means that the number of people working must pay for the GDP necessary to cover all those citizens, or the formula has to change in the cost ratio of how goods are being delivered. And this is happening all across the world. This is happening literally in the next 3 to 5 years. We're going to crescendo with the silver tsunami. So the economic imperative is there. Fundamental strategy in this shift is critical. So strategy is everything at this point. A roadmap.
Thank you.
And if I please may ask, a roadmap for your country, and of course Russia is massive, is big, they think frequently they can do it independent, but a roadmap should fit in the global roadmap where the rest of the world is going. This is definitely sure for the Netherlands, but also sure for you, for Russia, because healthcare is not a business on its own anymore per country. If you see how many people we fly out to be treated in Spain, in Portugal, or in Turkey, it is tremendous. And if we don't have semantic interoperability, and if we don't go to the same goal, we have a problem. And by the way, we will export more and more patients, not because we can't treat them at home, but it's much cheaper to send them to Spain or to Turkey.
Yeah.
And why is Russia not a part of this? I just don't understand. You have the industry here, you have very nice people, good food. St. Petersburg is an excellent city. We Dutch people feel ourselves extremely at home here. Why not be a part of the total transition in the world, that we get specialist areas where people are doing very well? Like hip replacements goes to Spain, knee replacements to Portugal. Well, you could do some more complex things. In the old days, we sent people for heart surgery to Houston. We send them now to England. You should be a part of that global process.
Medical tourism.
Call it medical tourism, yes. But medical tourism requires a few things. Semantic interoperability, transparency, absolutely till the bone, very well electronic records, and something like what we would call good hotels near to the hospitals. In Essen, they do, for your idea, 25 open heart surgeries per week, and they have only 20 emergency beds. The rest of the time the people are in the hotel next door. Because please understand that a hospital in general has got an extreme bad hospital management, bad food, bad beds, and you shouldn't be in a hospital bed unless. So do what you're good at. Proper operation, proper doctors, telemedicine, and ask, let's say, a 5-star hotel to become next to your hospital. Yeah,
Jochen.
you're laughing at me, but then you can make money maybe to pay your own people.
This is actually something that hospitals and specialty centers around the world are doing. If you're familiar with the Mayo Clinic in the United States, they are so excited because they just got a 5-star hotel now being built and opened up inside Rochester, Minnesota, and which is a very small town. It has one industry, which is the Mayo Clinic. But they have fought very hard. In the end, they subsidized putting in the 5-star hotel. But the medical tourism piece is real because what happens is people come, they stay in the hotels, and the revenue goes up. I think this is the point you were making, but I recently spoke with the CFO of a large hospital chain, and he had just finished building another hospital, and he said, I've come to the realization that we are a wonderful factory 12 hours a day. From 6 in the morning to 6 at night, we are a fantastic medical factory. And from 6 at night to 6 in the morning, we become a bad hotel. And we've got to fix this formula. We've got to figure out how to maximize our productivity during the night and get people into better rooms and accommodations. It's not, of course, saying that every hospital is a bad hotel, but it's not the primary business, right?
Yeah.
Yeah. Anyway, it's interesting sidebar.
Johan, thank you a lot for your motivation. Words, it really motivates, and it really changes the mind, how it's possible to organize healthcare and how it's possible to be the part of international medical society and business. Есть ли какие-то вопросы к нашим спикерам? Тогда объявляю наши... Yes.
Can I ask, is there any one of you who thinks that there are a set of lunatics in front of you? Are we dreaming with you, or are we realistic? Come with your comments. Because the only way that we can do our work good here and in the rest of the world is that we are in communication with you. And that if we are an idiot, then we should have the right pills or the right institute. But if we're not an idiot, you need to help us to change the things. I told you previously that the end of my career is near. I've been working now 20 years in healthcare, of which nearly 8 years as ambassador of the Dutch government, especially for health. I've tried to change as much as I can, and I have come to the conclusion the only way that you can change is because you want it and you do the change. I can do the talking, but you do the change. And if at the end of the day we are there on the roundabout and you ask me, Johan, which exit can we take best? Of course, then I will be there. And Hal will be there, and Michael will be there. But it's you only that needs to decide, this is the road we go, this is the planning we have, and this is what we want, irrespectively what it costs, irrespectively what your government says, irrespectively what is possible now. But if there is any change, it's you that has to do it.